Hey Mones, welcome back to my channel. If you are new here from the title, just searching and interested in this, then make sure if you like, comment, and subscribe. Just keep up with Bree, keep up with me. And yeah, let's get to it. So today is my pre-op appointment before surgery tomorrow. I will be getting the laparoscopic tubal ligation, which is basically getting my tubes removed, girl. Removed, not tied, not clamped, removed. I chose this option because first I have a 12-year-old son, Ryan, and then I started back over and I got a newborn baby, Rain, my daughter, and actually today is her 5-month birthday. So she's 5 months today. Woo! So excited to get back home with her and take some pictures and celebrate that she's 5 months today. But yeah, I am in my 30s. I am in my early 30s, but I just feel like I don't want any more kids. I have my boy, I have my daughter. My partner, of course, he at first he wasn't agreeing, but then once Rain got here and it's just a whole different story. He was just like, okay, I stand beside you. I didn't want to get on birth control anymore. I've been on birth control my whole 20s, damn near, since I was 21. I had my son at 21 years old, and I've been on birth control since until like 28. And I've been on a depot, the shots that you get every 3 months. And then I was on birth control pills that you have to take every day. And then I stopped because I just had a lot of side effects. I'm not sure about like face breaking out or hair falling out, but I know I was gaining weight, which I loved though, because I was very thin, but I also was getting headaches, which I hated. And I still get them to this day. So I don't know if that was like the side effect, but I just blamed it on a birth control, and I just didn't want to put anything else in my body like that anymore because I just been on it for so long, almost 10 years. So I just stopped doing that. And then I met my partner, like 29, 30 years old, and we just, got pregnant last year, had my baby, and I was just like, okay, we're still in love, we're still together. I don't want to be on birth control. I have to make a adult, mature decision on what I want to do, so I won't come up and have 3, 4, 5 kids that I don't want. Kudos to the women out there that have 3, 4, 5 plus 6 kids. I'm just not that one. So I've looked into getting my tubes tied. And I went to one doctor who takes my insurance, and they were just basically saying, oh, if you get your tubes tied, there's still a possibility that you can still get pregnant. Let me turn my car off. The baby would just, the pregnancy would just get stuck in like the tubes or whatever. Like, it's a possibility that can happen. Atopic pregnancy. And I was like, oh, definitely don't want to deal with that. And then I heard about the clamps, that they can clamp your tubes, and then they can remove the clamps when you're ready to have more kids later on. Well, I'm done. I don't want any more kids at all. So I researched that, and they was like, sometimes the clamps can fall off and then you become pregnant. And I've heard stories. I've known some people in the past who had their tubes tied and got pregnant and had to go through so much stuff. So I was just like, I don't want to do that either, even though those things are not as invasive as what I'm doing now. But I'm making this decision for myself, to get my tubes removed. Having kids is a beautiful thing. It's so beautiful. I love my kids so much. My whole heart's like, and I'm so grateful and thankful that I was able to have kids, and especially a boy and a girl, and they're just so sweet and they're so cute, and I love them so much. But I'm two and done, baby. I'm two and done. So right now I'm at my pre-op appointment. I guess they just going to go over everything. I'll bring my phone in. I don't want to record with my camera because it's a doctor's office. They may be like, put your camera up. So I'll just have my phone and kind of like try to secretly record some of the things that they're saying. And then after my pre-op appointment today, I'm going to the hospital to meet with the nurse practitioner, which maybe she'll be going over the same things with me, what I can't eat after midnight, probably wearing loose fitting clothes tomorrow for my surgery. They want me to be at the hospital tomorrow at 5:30, but we'll see if that's still at 5:30 in the morning tomorrow, because I'm about to meet with them now. But yeah, so let me just read off what the tubal ligation is. It's a minimally invasive surgical procedure used for permanent birth control. Permanent birth control. So like I was saying before, I was on that birth control, the pills, the shots. Well, this is a permanent. Sorry, I'm drinking my coffee because it's so early in the morning. So basically, during the procedure, a surgeon blocks or seals the fallopian tubes so eggs cannot travel to the uterus and sperm cannot reach the egg. So basically, the surgery is going to be performed under general anesthesia. So they're going to put me to sleep. I've been asleep before for a previous surgery. If you want to know about that, look on my YouTube channel, and I'll have my surgeries that I've had before in the past, and you can read about that as well. So they're going to make small incisions made near my belly button. And I remember the nurse practitioner a couple of weeks ago told me 3 incisions. So like small incisions, but it's going to be like the size of my nail. Like it's very small. So they're going to make 3, and then they're going to take my tubes out. And I don't think they sew me back up. Maybe staple. I don't know. It's a small incision though. It may just heal on its own. And then they're going to put a camera, which is a laparoscope, and they're going to insert it. And then they're going to just remove the tube and just do it like that. So basically, like as far as recovery, usually the same day discharge. That's what it says on Google. As far as pain, it says mild abdominal discomfort, shoulder pain from gas during surgery, or light bleeding, which I expect. They said most people return to normal activities within 3 to 5 days. So I'm hoping that, because I don't think I'm going to be able to pick up my baby girl starting tomorrow, because tomorrow's surgery day. Probably tomorrow, Friday, Saturday, maybe Sunday. She is about 13, 14 pounds. So I don't know. But the effectiveness, it still says over 99% effective as permanent birth control, contraception. So I'm just like 99%, but I get it. Nothing is 100%, but over 99%, that's damn near 100. So when my tubes is out, it's like it's no possible way. It can't be. And then it also says it's not easily reversible. I remember the nurse practitioner told me that if you get your tubes removed and then later down the road you want to get pregnant again, you have to go through IVF, and that's a lot of money and a lot of things you just got to do, and I told her I'm good with my tube, baby. I'm good. I promise I'm good. So yeah, the risks are bleeding or infection, injury to nearby organs, ectopic pregnancy if failure occurs in reaction to the anesthesia, which, I know about that. I read about that. And yeah, I'm going to pray with my family tonight. I'm going to pray with my family in the morning. I'm a girl that has very, very bad anxiety, but I got this. So I'm about to come in here so I can stop talking y'all head off. I've been talking for almost 10 minutes. I'm finna come in here. Like I said, I'm going to bring my phone with me and try to sneak some information of what they're telling me. And yeah, so let's go. Hope y'all enjoy.
It's in your sign, okay. Today's date and whatever time. And if you have any questions, you can still talk to the doctor. And this one is for a blood transfusion. This is for the procedure. On that first sheet. And this is for the blood transfusion, for a blood transfusion. Just in case. It's not saying that they actually going to do it. It's just in case.
Okay. Hey, y'all. So I had to sign a consent form, basically explaining the procedure and the risk and blood transfusion, just in case I need it while I am asleep while they're performing the surgery. So I'm just waiting on the nurse to come. Look at my shirt. Hey y'all, so I don't know if y'all, let me stop and let them go. I don't know if y'all got like a little bit of what the medical assistant was telling me, but I did meet with the doctor as well, and she was just going over basically what I told y'all, all the stuff that you can find on Google for real. And she gave me some papers for me to sign and know more about the procedure. I'm gonna just let these people go. Go ahead. About the procedure, and right now I'm headed to meet with the anesthesiologist to get so they can take my blood work to make sure I'm healthy and I'm good to go for the surgery. Initially, they told me a couple of weeks ago my surgery was at 5:30 a.m., but they changed it to 9:30. So I'm like, oh, period, because 5:30 was a bit much, okay? Even though this hospital is not that far from where I live, but it's like, girl, I don't want to wake up at 4 to have surgery at 5:30. Like, I'm not a morning person at all. So I'm headed to the hospital right now so they can do my blood work, and then we'll go from there. So yeah, y'all, I'm getting nervous, but it is what it is. So I'll see y'all when I get into the hospital. I'm over here just driving all over the place. I'm just trying to find, I gotta park level 1. I'm just trying to find parking. And then they told me to get off on the first floor. Like, I'm finna be lost in a minute. I've been just driving in the parking garage. Right now I'm on level P2. I need to put that in my phone so I won't be lost. I just need to find some parking and where the elevator at. Oh my gosh. I made it. I'm here. So I'm in the waiting room. Waiting to be checked in. Hey y'all, so oh my gosh, once I recorded that parking garage, once I parked, girl, I was lost trying to get into the building, but I forgot to record everything for y'all, so I apologize. It's hours later. I don't know if y'all can see from the back. It's nighttime. Well, it's 5:30, but it gets dark out here now. But anyway, so I met with the nurse practitioner at the hospital, and then I met with the nurse. I'm sorry, the anesthesiologist, the one who's going to give me the general anesthesia to put me to sleep. So they basically went over what you can probably Google yourself, y'all, is, got to take my earrings out, no metals. They asked if I had veneers or anything like that. They asked if I had any issues with anesthesia before. In the past, if I ever had surgery. They just asked like a lot of health questions, and then they also took my blood to just do some testing. They said if I get a call back, I think they said today actually, and they leave at 5 and it's 5:30. So I'm glad. I know I'm a healthy person anyway, but that's also good news. They said if they call me today before 5, then that means something came up with my blood work. So I passed that. So yes, so surgery tomorrow is at 11:40 a.m. It was at 5:30 initially a couple of weeks ago. I don't know what happened. I'm not complaining at all. So I have to be there at 9:40, 2 hours before surgery time. Trub is going to drop me off, sit with me in the waiting room until they call me back, and that's going to be that. Now, like I said, I'm going to bring my camera. No, I'm lying, because I'm going to be out of it. I'm going to bring my phone, and I'm going to get a little bit, I'm going to just get a little footage for y'all, and then once I get back home, I'll just give y'all an update on how I'm feeling after the surgery has been performed. But I just want to close this out just for today, and I will see y'all tomorrow. Bye. Hey y'all, so it's literally the next morning. I'm just waking up. I am about to brush my teeth, wash my face. I'm going to get in the shower again, and I am going to, let me show y'all what I have to use to, I have to show y'all what I have to use to wash up with. So it's this Hiba cleanse. Oh wait, y'all lost me. My camera want to do whatever. But anyway, it's this Hiba cleanse that the hospital gave me. So I used it last night, as y'all can see. And I got to use it again this morning. So basically, I just wash up with my regular soap. I use 3 different soaps every night. I use Dow soap first, and I use any type of body soap. shower gel after that, and then I use Dove sensitive soap, and then I'll put this on after. So I'm about to do that, and I cannot put any creams on, no lotions, no deodorant. I can wash my face with I use this. I can wash my face, but I can't put like my moisturizer or anything on. So I'm about to go ahead and do that, and then put on some loungewear clothes because they want me to wear something loose. Do I feel like showing y'all my stomach? This is how my stomach looks right now. No cuts or anything like that. I just got a mommy stomach. I literally just had a baby 5 months ago. So that's just how my stomach looks after having a baby. Having 2 kids. But I'm about to run the shower because I need to hurry up and get in the shower. I don't have to pack a bag or anything like that. Yeah, I don't have to pack a bag. They did say leave your credit cards, debit cards, and all that stuff home. So I'm like, I don't know. We'll see. But they want me to bring my ID. I'm like, I don't really carry my ID without my card holder. My card holder got all my cards. We'll see how that goes. I might just ask for a locker when I get there. But let me go ahead and get out y'all face like this so I can brush my teeth, wash my face, look a little bit more presentable. And I'll be back on camera after I get out the shower. Y'all, I literally just got out the shower and I was about to put on some lotion already. Like, oh my gosh. I would have had to hop back in the shower. I would have had to take another shower. I'm not risking nothing. No infections, none of that. Okay, y'all. This is probably going to be y'all last time seeing me well awake and like pre-cut, pre-surgery. I'm probably going to go downstairs with my mom. She's staying here with Rain while Miles dropped me off at the hospital. And she's going to stay here until I get home too. But we're probably just going to pray. And then my nose is so shiny for me not to have put nothing on my face. But we're going to leave out. Yeah, the hospital's about 30 minutes away, which is not bad. We need to leave here at 9. It's 8:45, so I don't have to do nothing else but just take this out my hair. These bendy rollers and put on my jacket. Go ahead and go. So I will see y'all. Wait a minute. All right, I'll be back. Because this right here, I can't go to surgery like this. I don't even know why it's stuck. I'll see y'all in a little bit.
God, we ask that you just allow my girl to have a very safe procedure, have as less pain as possible. You know, they're going to put her under that anesthesia. She's going to wake up fine. This procedure, everything's going to go good. We know that you, man, watching over us the whole way, watching over everything. And we just trust that this process is going to go great and smooth as it's supposed to be. In your name we love and praise. Amen.
Amen. Hey y'all, so I made it here at the hospital. I'm in the waiting room with Trev. He's waiting with me. Hey. I look so dry, like no moisturizer, no nothing. But I checked in on time, just waiting for him to call me back. I don't know if you can come back with me. I don't know if you can come back with me or not. I'll ask once they call me.
Yeah, we gotta see, man.
But if not, you gotta give me a big hug and a big kiss.
Yeah. Everything gonna go good, man. You know what I'm saying? It's gonna be real smooth, you know?
Yep. All right, y'all. Hey, y'all. We are in the hotel. We are in the hospital. They want me to put on this gown, some calf. What's it called? What did he say about these? This is...
He said like for circulation.
For circulation. I'm getting nervous, y'all. Sorry. And then antiseptics to wipe down my body. I have a warm blanket. I have a hospital bag. I have some hospital anti-slip socks. And I have this where I can put urine sample in here to make sure I'm not pregnant. So I'm about to go ahead and get dressed in that. Yes, you can come in. And then we'll be right back.
Appreciate it, Tubal.
Why are your hands snapping? Okay, y'all, so I'm waiting for the nurse to come and get me, and Travis gonna go.
Yeah, everything gonna be alright, baby. We done prayed about it, man. You know you're gonna be good. You know, gotta have a successful, great surgery. Yeah, you're gonna be straight, baby. I love you too. Everything gonna be alright, man.
Everything gonna be okay. Grace of God, we got faith.
Successful.
Yep.
Yeah, be me that number 4. I'm just playing.
I'm out of surgery, y'all. This is the real raw footage with sleep. My eyes looking crazy. I'll talk to y'all when I get in the house. Hey Monette, so this is day 1, night 1 actually. It's about, what time is it, babe?
7:47.
7:47 at night. So I can't take a shower tonight. I'll take one tomorrow when I wake up. I just changed from my hospital clothes and I put on just another t-shirt, loose fitting t-shirt. Let me show y'all. And then they gave me some of these hospital shorts, and it's a pad. I am bleeding a little bit. My stomach is swollen as well, so I'm going to use an ice pack. I'll show y'all that in a minute. But I'm going to put on some of Trail's boxers too, because it's loose fitting on my stomach to go to sleep in, on top of these hospital shorts that I got, to just be a little bit more secure. And then yeah, so right now I don't feel no pain. I'm just tired. I have this sticker on the back of my ear. I don't know if y'all can see it. It's basically to help with nausea, but it's making me drowsy. So some people prefer to be nauseous, so they'll take the sticker off so it won't make you drowsy, make you sleepy. I prefer to be drowsy so I could just lay in the bed. They say you can keep this on for like a day or two. I'm going to keep it on until I feel like I'm good and just take it off. So probably about tomorrow, I'll do that. But right now, I have my ice pack right here. It's a reusable ice pack. You just fill the ice up and I'll place it on my incisions. And then I have this machine right here where basically, let me show y'all. I have to breathe in it to help my lungs. So let me show y'all.
You need me to hold the camera?
Yeah, baby, please.
Shit kind of hard to do with one hand.
Yeah, thank you.
I can't see.
Oh.
Oh wait, I'm tripping.
Oh.
Yeah.
Yeah,
it's on you.
Okay. So basically, I gotta get this green thing to this happy face right here, and I have to do it every hour. But if I'm asleep, he don't have to wake me up. So
Remember, do it slow.
ain't nothing coming out, so maybe I did it wrong.
Wait, you blowing in it?
Mm-hmm.
No, you supposed to.
Oh yeah.
She smoking that thing like a hookah, y'all.
Hold on, wait. Lungs still good, even with the hookah lungs, period. Okay, next, follow me. I got bottled water over here. That's all I want to be drinking until Monday, for real. And Monday, I'm always on my water diet anyway, so I'm just going to be drinking water. No more juice. I have this laxative powder. I need to take that once I take the, I don't want to put my address on there. Nothing.
Why like that motherfucker not trying to focus?
I think you're too
close,
yeah. This is a Percocet. I get constipated when I take Percocet, so once I take a Percocet, TMI, skip it. If you don't want realness, go to a different channel. I'm gonna take some powder right after I take the Percocet because I don't have time. But my main thing is when I feel pain, I'm gonna take ibuprofen. Take 1 tablet by mouth every 8 hours.
Nudie, be quiet,
pain.
Boy.
It's for pain. I don't have to take it right now because I'm still feeling all the medicine they gave me at the hospital. But once I start feeling pain, I'll take the ibuprofen. If it's still excruciating, like I said, I'll do the Percocets and then take a powder of the Miralax. This, I just wanted some candy.
Show them kind of candy there.
Nerds, my favorite. I love nerds, y'all. And I don't like the rubber part. I just like the straight nerds. I don't like the gummies. And then I got of course, my little Bible. 5-minute Bible study for women that I need to get on to. But yeah, so that's So babe's about to
Tuck her in.
tuck me into bed. I'm not really
then I made her little ice pack for her, y'all.
Yeah, I'm not really sleepy, but I'm just tired and out of breath. So just put it right here. And they said for 30 minutes. So what time is it? It's 7:52, so about 8:20. I'm going to take the ice pack off and I'll be good until tomorrow. Then after that, I don't have to do it no more. So I'm going to make sure it's really on there though, because I want it the swelling to go down. But yeah, I'm so glad everything went good. I will update y'all on day 2 tomorrow. Good night. Hey y'all, so I know I'm in the same clothes. It is the next morning. The only thing that I'm feeling a little uncomfortable about is my throat is very sore and scratchy, and I know they told me that excuse me, they told me that that's what's going to happen because they had to put a tube down my throat to help me breathe. And then also when I use the bathroom, like when I pee, I haven't took a bowel movement yet, a BM yet, I'll say. But when I use the bathroom, when I have to pee, my vagina is kind of like sore because they had to insert a camera inside of my vagina to find the tubes to take out. And then the other thing is it's kind of hard for me to breathe. So I'm going to use that breathing machine that I showed y'all last night and probably just lay in the bed all day today. I'm going to get up a few times just to walk around so I won't get any blood clots in my legs. But other than that, I'm probably going to be in the bed all day today. Today is Friday. Tomorrow I'm going to just gradually do a little bit more every day because I got to go back to the money on Monday. So yeah, that's what I'm going to do. So I just wanted to check in with y'all. I'm about to brush my teeth, wash my face. I don't need any medication right now. I'm still, it's like a little sore when I do this on my stomach, but not really. So I don't need the ibuprofen or the Percocet, not yet at least. But Trey brought me up some cough drops to suck on because my throat is very sore and very scratchy. It's hard for me to cough. And then I don't look forward to peeing because my private area is sore once I pee. But other than that, y'all, it's going pretty good. So I'll check back in with y'all later on. Day 2. Okay, hey y'all, it is day 3 of my surgery and I am feeling better. It really wasn't horrible at all. I had to come in here because Rain is listening to her cartoons and I don't want to get copyrighted. But anyway, so yeah, day 3, pretty much the same symptoms as day 2, which was my stomach is still sore a little bit. My baby girl did hit my stomach last night, so she slept with dad. But today it didn't feel like anything. I did take ibuprofen yesterday, like later that night. I think because after she kicked me in the stomach, it was a little sore. So I took 1 ibuprofen. I don't need it today, thank God. I don't need the Percocets, thank God. Yeah, I just got out the shower. I let the water hit on my sores or my cuts. It is closed. It's sealed with skin glue, basically. That's the terminology we know, skin glue. Remember I have 3 cuts, 1 on each side of my stomach, and then I have 1 where my belly button is, and they're all 3 sealed up. So I'm just gonna let the scabs fall off once it's healed. This is probably gonna be my last update. My throat is a little scratchy and sore, if y'all can hear or see me and hear me trying to catch my breath and clear my throat. So I am going to use a little bit more of that lung machine just to get my breathing a little bit better because, you know, once you go under anesthesia, it slows down your breathing, your lungs. So they say you don't want a pneumonia, so go ahead and do that. So today probably my last day with that breathing machine. Yeah, I'm so excited and happy that I did this. I wouldn't want it any other way. I love both of my kids to death. They're my hearts, but this was like the best decision that I could have made for myself. So 2 and done, a boy and a girl, 12-year-old and a 5-month-old baby girl. So I'm going to go ahead and end this vlog here. I hope you liked what you've seen and got some information, gained some knowledge. And if you're out there wanting to do the same thing, get your tubes taken out, or if you want them clamped or tied, just let me know in the comments. I did do a lot of extensive research on this before I actually got the surgery. So if you have any questions about what I got or something similar, just let me know in the comments and I will respond back as soon as I can. And if you want to keep up with Bree, you know, I have a channel where it's traveling, beauty, everyday life, mom life, going out. It's my lifestyle vlog. So if you like what you see when you came to this video, make sure you like, comment, and subscribe and keep up with me. To the Monettes, I love you all so much. And I will also keep y'all updated throughout my everyday life vlogs about my surgery as well. But this is just a surgery vlog. Thank you so much for watching, and I will see y'all in another video. Bye.